What is Healthcare Fraud and Abuse, and How Does It Affect Honest Providers? By Lynn Williams. Hospice provides comfort for families, caregivers, and beneficiaries. Beneficiaries forego curative care for the terminal illness and choose to receive palliative care instead. The care can be provided in a number of different settings, including the home, nursing facility, hospital, and hospice inpatient unit. Hospice care has grown steadily the last decade. As you see from the slide, it has grown from 9.2 billion Medicare dollars in 2006 to 16.7 billion spent in 2016. With the steady increase in hospice care, cases of healthcare fraud and abuse have also increased. Healthcare fraud is knowingly submitting false claims or making misrepresentation of fact to obtain a federal health care payment. Examples of fraud include billing for appointments the patient did not attend, billing at a higher level of services than needed, billing for services or supplies not provided, and paying for referrals. Healthcare abuse is the unnecessary cost to Medicare program, including not providing patients with the necessary medical services that meet professional standards. This would include billing for unnecessary medical services, excessive charges for services or supplies, and upcoding or unbundling codes on a claim. OIG identified vulnerabilities with hospice. Through evaluation and audits, concerns were raised about billing, federal oversight, and quality of care. They found cases of patients being enrolled without beneficiaries' knowledge, billing for services that were not done, enrolling patients that were not terminally ill, paying kickbacks, and documentation that was falsified. Inappropriate billing by hospice have caused Medicare millions of dollars in inappropriate payments. The OIG report found in 2012 that one-third of inpatient stays were billed incorrectly. Inpatient stays are the second highest level of care and cost Medicare $268 million. For providers, healthcare fraud and abuse cause closer scrutiny of care and potentially decreases reimbursement to reputable providers. It shapes policy, potentially decreasing access to care and eligibility. Payers will then limit the benefits and level of care that are covered. Co-payments and deductibles for patients will increase, driving up out-of-pocket expenses. Fraud and abuse triggers rising healthcare costs, and employers are unable to absorb the benefit costs, thereby passing the costs on to the employees and bringing down wages. Physicians with smaller practices may leave their practice due to being too costly to operate.